Welcome, everyone. Thank you for joining us. My name is Julie Cullen, Managing Editor at HealthCom Media, the publisher of Wound Care Advisor, American Nurse Today, and several other healthcare-related websites and journals. I'll be serving as your moderator. Our topic today is Healing Wounds with Collagen. Knowing the difference makes all the difference. Our presenter is Martha Kelso, founder and Chief Executive Officer of Wound Care Plus. As a visionary and entrepreneur in the field of mobile medicine, Martha has operated mobile wound care practices nationwide for many years. She educates on the art and science of wound healing and how practical solutions apply to healthcare professionals. She started her career as a certified nurse aide at the age of 15 in Kansas before moving to Kansas City, Missouri to attend nursing school. Long-term care nursing was her first love and her biggest challenge. We welcome Martha today and thank her for her time and valuable information. This educational program is brought to you by Angelini Pharma, offering innovative solutions to promote infection control, antisepsis, disinfection, and wound healing. We thank them for their support. Now, please welcome our presenter, Martha Kelso.
Thank you for that introduction. I appreciate the kind words, and I want to say a quick thank you to Angelini for giving the opportunity to host this webinar about one of my favorite wound products, collagen. I think collagen is often underutilized or even maybe underappreciated. So I appreciate Angelini giving us the opportunity to discuss collagen openly, discuss a lot of the differences with collagen. During our webinar, we want to make sure that we're meeting these three objectives. We want to talk about what a wound needs, really what a wound wants, and why. We want to discuss the indications and contraindications for collagen, and of course, the considerations of collagen in treating and healing wounds. So let's start with our first objective. What a wound wants and needs, and of course, the why. I love the why of wound care. So what is collagen? Collagen is a dressing that helps encourage the body to organize newly formed collagen fibers and helps deposit or encourage granulation tissue in the wound bed. So collagen dressing is one of my favorite dressings because it actually contributes back to the body, stimulates that growth. Additionally, it comes in a lot of different applications. So it comes in sheets, it comes in a pad. They can be in paste or powder form. Some collagens come in a gel. Some of them come in powdered particles. And of course, collagen can be manufactured from numerous types of animals, including bovine, porcine, piscine, avian, equine. There's a couple others out there as well that are manufactured from other types of animals. So it comes in a wide variety of forms and a wide variety of manufacturing techniques. So why would we use collagen for wound healing? There's three key important factors on why you would consider choosing collagen for wound healing. Number one, the collagen dressing is going to stimulate new tissue growth and encourage deposits and organization of collagen fibers, and of course encourage new granulation tissue to form in the wound bed. Granulation tissue is our pie in the sky. It's what we love, seeing that nice beefy red bumpy tissue. When we start seeing granulation tissue, that's when we hope and we know that that wound is on the right trajectory to wound healing. Collagen dressings also bind to the matrix metalloproteinases, otherwise known as MMPs. MMPs are commonly found in extracellular fluid of wounds, and of course we know it can attack and break down collagen, stalling out wounds, keeping wounds from healing. It can turn into that biofilm, bioburden, which stalls out our healing wounds and converts them from an acute wound into a chronic wound. Of course, wound specialists generally accept the theory that collagen wound dressings also provide MMPs, an alternative collagen source for the MMPs to attack or digest, which then allows our body's natural collagen to be intact and available to help the wound progress. So 3 really important factors on why we would choose a collagen dressing. Additionally, collagen introduced to the wound bed attracts cells. It attracts those great growth factors that we need to help heal a wound, those fibroblasts and keratinocytes. Collagen says, come here, help me heal this wound, help speed up the wound healing with the fibroblasts and the keratinocytes. So fibroblasts and keratinocytes encourage debridement, angiogenesis, which is creation of new sources of blood flow, and of course re-epithelialization of the wound, where we're getting that new skin to form. These items need a scaffold or a substrate for new tissue growth. Collagen dressings help provide that. The scaffold gives a spot for cells to attach to and to proliferate across. We know that cells migrate from the outside of the wound edge inward. That scaffold helps bridge the gap, so to speak, so that cells can move further, faster, and actually start promoting the granulation tissue to heal. So let's cover indications and contraindications of collagen. We know that collagen is indicated for partial thickness pressure ulcers, full thickness pressure ulcers, venous wounds, donor sites, surgical wounds, vascular ulcers, diabetic ulcers, second-degree burns, abrasions, traumatic wounds. It has a wide variety of different wound types that it can be used for versus just being used for diabetic wounds or venous ulcers. So it's nice because collagen can be used for almost any type of wound according to the indications. 2 wound types that we would probably want to steer clear from, of course, are going to be your third-degree burns and wounds covered in dry eschar. A couple other wound types. As a wound specialist myself, it's not listed in the package insert, but you may want to consider not using collagen for malignant wounds or suspected malignant lesions, possibly open ulcers. Again, that's not in the package insert, but as a wound specialist, that's my experience. Considerations of collagen in treating and healing wounds. We have to be careful on patient sensitivities. So of course, if a patient has a sensitivity to pig or porcine, we would want to choose a collagen that isn't manufactured or derived from pigs or porcine. Same with ovine or sheep. If they have a sensitivity or an allergy, bovine or cattle, we would want to switch and choose a collagen that's not manufactured from pigs, birds, anywhere that they have a sensitivity or an allergy. So again, it's nice because with collagen, we have a lot of different options for people that may be sensitive. Additionally, some cultures or religions may have a please don't use cow products, or please don't use pig products, do not consume them. And so for religious or cultural considerations, you would want to go to the authority for that religion or culture to clarify what can be used. So let's talk about BIOPAD. BIOPAD has a phenomenal role in wound healing, and we want to make sure we highlight that today. So what happens in a chronic wound? What happens when chronic wounds start to heal? We know that there's deposition of new collagen. In a chronic wound, though, the deposition of that new collagen is delayed. Anytime we delay wound healing, we risk the wound not going to complete closure. We risk side effects like infection. We risk having to put them on antibiotics. We want to make sure that these chronic wounds are healing as quickly as possible. Recruitment of fibroblasts that synthesize collagen is also delayed in chronic wounds. Elevated levels of MMPs and elastase are responsible for proteolytic degradation of collagen. Age-related delayed wound healing is caused by impaired collagen synthesis and increased degradation as well. And of course, in diabetic patients, hyperglycemia, elevated blood sugars, reduce the collagen production and induces the formation of abnormal, rigid collagen. It's not readily accessible to be used for wound healing by the body. So what does BIOPAD do? How does it help solve those problems listed on the previous slide? Number one, BIOPAD is a soft gel dressing. That means it conforms to the wound bed. It only uses type 1 collagen, and approximately 70% of collagen in the skin is represented by type 1. So of course, if we're missing collagen as a wound healing, it's causing the wound to stall out or become chronic because the collagen is missing, we would want to reintroduce the type of collagen that the body's missing to stimulate wound healing. 70% of the time it's going to be type 1. Native structure creates better interaction with the host. When we know that we're replicating or similarly replicating what the body's missing with what the body can produce on its own, that native structure makes it readily acceptable by the body. With BIOPAD, you're getting up to 5 times the amount of standard collagen. We're going to cover that in just a minute on another slide, looking at the different collagens and how many milligrams of collagen we're putting into the wound. But basically put, BIOPAD accelerates wound healing. It's easy to use and it fills large voids because of that soft conforming gel dressing. They're giving you the highest collagen content on the market, and it's 100% pure, native, equine, type 1 collagen with no fillers. Several collagen dressings on the market have fillers. It's not 100% collagen. So indications for BIOPAD is very similar to what we covered on the previous slide for collagen indications, but they have a few more than standard collagen. On this BIOPAD, it's covered for partial thickness wounds, full thickness wounds, surgical wounds, traumatic wounds, wounds that have drainage, podiatric wounds, other bleeding surface wounds. We can use it for pressure ulcers, venous insufficiency ulcers, diabetic ulcers, dehisced surgical incisions, post-laser surgery, and of course donor sites and lacerations. So BIOPAD has a more robust indication line for wounds that may chronically stall out or not heal. So how does it work? How does BIOPAD work with protection, stimulation, absorption, and inactivation to get a chronic wound to convert to a healing wound? BIOPAD protects the wound bed from the external environment, so it acts like a barrier against the exogenous infective agents. It has a high amount of collagen, so BIOPAD can sacrifice some of its content to feed MMPs and elastase while still having enough collagen left over to continue to stimulate the body and introduce collagen back where collagen may be missing. BIOPAD also stimulates the formation of new granulation tissue, the migration and proliferation of fibroblasts, and then the deposition of new collagen fibers. It's one of the key ingredients with BIOPAD, how it stimulates the formation of that granulation tissue while encouraging cells and growth factors to do what we need them to do. And thanks to the porosity, BIOPAD acts like a sponge, so it's able to absorb some amounts of exudate. Additionally, we talked about the native structure of the body and how BIOPAD mimics that native structure. Here's what it looks like under a microscope. So on the left-hand side, we have a collagen dressing that mimics native structure. The native structure is correlated to the capacity of the collagen to interact with our biological tissue. On the right side, the collagen dressing, this particular collagen dressing has a denatured structure. So you can see how disorganized it is, how it does not look native, and the body would have a hard time replicating or using that denatured structure to integrate cells. Some of the benefits may be lost if the collagen is denatured in the manufacturing process. BIOPAD is an ivory white soft sponge. We talked earlier about how it's made exclusively of type 1 collagen and why that's important. 70% of our body is made up of that type 1 collagen. Its equine origin makes sure it keeps its native structure. Additionally, the majority of the population does not have an equine sensitivity or allergy, and the majority of religious and cultural considerations do not have equine listed as a reason to not use the product. BIOPAD has the highest collagen content currently on the market. It's 250 milligrams of collagen that we're introducing to the body. 250 milligrams of collagen that we can use as a sacrifice to those MMPs that are hungry and actively trying to take over some of the collagen in our body. See, let's look at some of the other examples on the screen. We can see Endoform has about 90% collagen. Puricol, about 88.4%. Colactive, 83%. Pomegran, 57.2%. So BIOPAD has about 250 milligrams of collagen, type 1 collagen. Colactive has about 200 milligrams. Pomegran, 60 milligrams. Puricol, 50 milligrams. We know these chronically stalled out wounds that need collagen introduced to attract those fibroblasts, the keratinocytes. We want to give it as much collagen as possible so that the wound will really fill in and not be stalled out any longer. 250 milligrams of collagen is a lot. It's great. So let's look at a competitive analysis. We know BIOPAD has type 1. Puricol also has type 1. Endoform has type 1, 3, and 4. Colactive, they use a gelatin-type collagen. Pomegran, we're unsure of what type of collagen they utilize. With BIOPAD, we have 100% native collagen, Endoform 90%, Pomegran 55%, Puricol 88.4%, Colactive is going to be 83% collagen. The thickness of BIOPAD is about 5 millimeters. It's a wafer. So it can turn into a gel once it's activated through moisture, whether that's through wound drainage or moistening it with saline. And that 5 millimeters turns into a gel that helps fill the void or fill the dead space of the wound. Endoform, it's 0.4 millimeters thick. Pomegran, 3 millimeters. We know BIOPAD and Endoform and Puricol all have native structures. Pomegran and Colactive do not. BIOPAD is made from equine, Endoform is ovine, Pomegran bovine, Puricol bovine, Colactive is porcine. So BIOPAD has all 6 things we should be looking for when we're choosing a collagen. It's type 1, it's 100%, it's got enough collagen for what the wound needs, it has a nice thickness of 5 millimeters, it has the native structure that our body desperately seeks, and of course made from equine. So how would we use BIOPAD? We would want to prepare the wound bed per the facility's wound care protocol, whether that's cleaning the wound first, whether it's cleaning it with saline, soap and water, but usually you clean the wound, autolytically debride if you need to, maybe mechanically debride. Of course, if you have access to a wound specialist that can sharp debride, we want to prepare that wound bed, get down to healthy tissue if possible. Then we're going to cut the BIOPAD if we need to fit the size of the wound. And again, wounds with limited exudate, we would want to hydrate with BIOPAD with sterile saline. Hydrate that BIOPAD with sterile saline. Wounds with heavy exudate, you don't need to hydrate. You can rinse the wound bed out with a saline solution prior to the application, get the wound bed clean. But we're going to apply it directly to the wound bed. We want to cover the entire wound bed. We don't need to overlap the edges. The gel that's formed with the wound exudate is biodegradable, so it doesn't need to be removed. Hopefully when you come back, you won't be able to see the BIOPAD because it's integrated down into the wound. The wound has absorbed the collagen and it's already escalating into a healing phase. We do have to use a secondary dressing. So usually it's per standard of care, whether it's a dry wound, so you're using gauze, or somehow absorbing drainage. If the wound's draining a lot, you can reapply BIOPAD every day or per the physician protocol. If it has a small amount of drainage, it can be reapplied every 48 hours. So again, the nice thing with BIOPAD, we have options. Let's look at some wound healing rates, and then we're going to look at some photos. So we tracked wound healing rates for 28 days in patients with chronic non-healing wounds using BIOPAD equine collagen dressing as the primary wound dressing. Primary meaning the dressing that's going right up next to that wound bed. Our total average healing rate was 87% in 28 days. That's remarkable. So we achieved 3 chronic wound types. We looked at diabetic ulcers, venous leg ulcers, and pressure ulcers. Let's look at specific cases now. Case 1, we had a diabetic ulcer. The gentleman was 53 years old. The wound had been there 4.5 years. 4.5 years. Of course, some of the comorbid medical factors that were playing into the delay of this wound was diabetes, coronary artery disease, congestive heart failure, and chronic venous insufficiency. They had tried several things in the past, everything from standard of care to a skin substitute, apple graft. He had had some rounds of hyperbaric oxygen therapy, and we had tried Endoform. So current treatment, switched him over to BIOPAD. And you're going to note by day 28 that the wound had healed in almost 50% based on the area, length and width, 50% filled in. Interestingly enough, if you look at the first photo on day 0, you can see that this wound looks chronically inflamed. It's starting to form those rolled edges like an epibole. It's starting to stall out. The body's really struggling getting it to heal, even though we've thrown advanced modalities at it. It's just not interested in healing. By day 28, you can see how much it's shrunk. The rolled edges are gone. We now have granulation tissue, epithelial buds forming. We're well onto a healing trajectory for the first time. 4.5 years, this gentleman now has hope that that wound's going to go on and heal at day 28. That's impressive. Case study number 2, a venous leg ulcer. Notice that this wound had been there for 3.5 months as well on the left medial lower leg. It's a 48-year-old, so to have a wound for 3.5 months is very unusual. But this gentleman also had chronic venous insufficiency and a known blood clot in that leg. They had tried compression, silver alginate, a course of systemic antibiotics, and Zeroform before we introduced BIOPAD. Once we introduced BIOPAD, you can see by day 28, he was healed. Wound 100% resurfaced or resolved. Case study number 3 was a pressure ulcer. Left plantar heel, it's a difficult place to heal when you're still walking on it. Unfortunately, they had to. And so the age of the wound was 6 months. Had a history of a colectomy. We had done debridement. He had had a cellulotome, epidermal autografting. We had done appropriate offloading. We had tried a different collagen. And of course, silver alginate. So we introduced BIOPAD, and you can see by day 28, 100% healed, resurfaced, resolved after 6 months of trying. That's remarkable. I wanted to cover ordering information. I get this question often, where can I get my hands on this great product? And it's covered in a lot of places. So Medline, Advanced Tissue, McKesson carries it, Byram, CCS, More Medical, Impact Medical, Prism Medical, and Mercy Surgical Dressing Groups. So you have a lot of options on how to get your hands on BIOPAD, and it comes in 2 sizes, a 2x2 and a 4x4. Main talking point or the message that we want to take away today, when you have access to the right tool, it makes all the difference for your patients. That's why BIOPAD's important. I'm ready to take questions now. So let's start with question number 1. When wouldn't you use collagen in wound healing? That's a really great question. As a clinician, a nurse that's used collagen now for over a decade, The times that I've found I would not want to use collagen is when a wound is clinically infected, but we have not started them on treatment for that infection. Collagen, of course, is not going to cure the infection. Antibiotics would be needed in that case. And so until we've gotten them on antibiotics, I would not introduce collagen. Once you've gotten them on a course of antibiotics, it's more than fine to introduce collagen into the wound at that point. What is my take on the mixture of collagen and honey base for wound healing, especially in diabetic wounds? Another great question. I always like to look towards clinical evidence to see if products have been evaluated together in usually a research study, whether that's prospective or retrospective. As far as I'm aware, there are no current studies on collagen with the use of honey. So at that point, we leave the question at that point. Can you use collagen dressings for packing wounds? The answer is yes, and there is powdered collagens on the market, but you can also use BIOPAD and break it up and use it to pack wounds. Because of the thickness of BIOPAD, it's actually ideal to use in deeper wounds as well. Additionally, can we use it if there's slough? Absolutely. And so we wouldn't want to use it if the wound is 100% slough covered, because obviously the collagen is not going to get to the base of the wound. However, if there is some slough in the wound bed and still healthy tissue, collagen would be the product you'd want to reach for. How long do I recommend using collagen if you do not see an improvement? Another great question. The CMS guidelines actually state that if a wound is not progressing within 2 to 4 weeks, we need to evaluate the overall clinical condition, including the treatment. So collagen might be the correct product to use. However, clinically, if the patient is not eating or maybe doesn't have enough nutritional stores, maybe they're depressed because a close relative of theirs has passed away, we would want to reevaluate the overall clinical condition and determine if collagen is still the correct dressing for that wound. How can collagen help partial thickness wounds? Obviously, our skin is made of collagen, and so if collagen is what is missing to get a partial thickness stalled wound to heal, you would want to moisten that collagen, get it nice and wet, put it on the top of the wound. So keep in mind, collagen is what the MMPs digest. So if there's MMPs in a partial thickness wound that's preventing the wound from healing, stalling it out, collagen is going to be that sacrificial substrate that the MMPs attack versus attacking the growth factors that the body is trying to manufacture on its own. Have we tried treating leg ulcers? Have tried treating leg ulcers with platelet-rich plasma and BIOPAD both at the same time? I'm not sure if the question is, have I tried doing that? The answer is no, clinically I have not. If the question is there a contraindication to using both at the same time, the answer would also be no. Those products, in theory, would be ideal to be used together. Platelet-rich plasma, of course, we're getting those growth factors derived straight from the bloodstream. We're spinning it down, we're taking the buffy coat, putting it into the wound, and then BIOPAD, again, is going to introduce collagen and allow those MMPs to have a sacrificial substrate while encouraging fibroblast and keratinocyte formation. So, great question. Can BIOPAD be used with the product BlastX? In theory, yes. Again, the two products have not been tested together that I'm aware. I've not read a clinical research study on it. But anytime that you're using a cleanser like BlastX, for example, if you're concerned about whether or not the product may be contraindicated to use with that cleanser, you would simply just rinse it out of the wound well enough that no more would be left in the wound before you applied the product. Okay. The next question is, can you combine BIOPAD with silver dressings? Yes, you can. Some collagens are manufactured with silver in them already. And so it would not be contraindicated to use a collagen dressing with a silver dressing. You can put both of them together. The next question is, can we use collagen or BIOPAD in a wound with less than 10% slough? Absolutely. And with that 10% slough, that could be developed from MMPs or from your biofilm. So again, collagen would be a great choice to use to reduce those MMPs and help fill the wound bed back in. So I do have to say we have run out of time. I want to thank you so much for participating today. If we were not able to get to your question, the contact name and email is now posted on your screen. Feel free to reach out to us with your questions. We'd be more than happy to answer them. Thank you so much for your time.